Good afternoon, all the second year student. Now, today we will discuss the new chapter, Sedative and Hypnotics. And Sedative and Hypnotics. Now, sedative and hypnotics are generally the CNS depression drug in the category. The sedative, definition of sedative. Sedative. The sedative are drugs which reduce excitement and calm the subject, inducing subject without inducing sleep. The sedative. See, the sedative are the drug which reduce excitement and calm down effect without inducing sleep the patient. Such a drug is called as the sedative. And the hypnotics, you know, the excitement there, it's very common, and the calm down means cool the patient, calm, and the quiet the patient, cool the patient. Next should be the hypnotics. Hypnotics are the agent. Hypnotics are the agent that induce or maintain sleep resembling natural sleep. The hypnotics are the agent which induce or maintain the sleep resembling like a natural sleep. Such is called as the hypnotics. Sedative hypnotics are the CNS depression on the basis of eye movement and EEG. Is EEG, electroencephalograph. That is a brain mapping graph. Normal sleep can be divided into two types. The first, rapid eye movement, that is called RM. Sleep second, non rapid eye movement, non-rapid eye movement is called as NREM. We will write down capital NREM. The sleep can be divided on the basis of the eyeball movement, eye movement, and the EEG, that is electroencephalograph, the brain mapping graph. On the basis of they divided into two types: rapid eye movement, REM sleep. Second, non-rapid eye movement, that is NOR-REM sleep. There are two types. Sleep can be divided into two types: rapid eye movement and the non-rapid eye movement. Now the first, see what happened in the rapid eye movement. Now rapid eye movement. REM sleep. It is the fastest wave of EEG, rapid eye movements. EEG is fastest wave of EEG sleep. Okay, first. Second, this phase associated with dreams. In this phase, dreams is occur. The associated with dreams. Due to the dreams, heart rate, blood pressure, respiration, tend to fluctuate. See, rapid eye movement, it is the fastest wave EEG in sleep. This phase is associated with the dreams. Due to the dream, the heart rate, blood pressure, respiration tend to fluctuate because of the dreams. Okay, sometimes you are sleeping, you are having the your sleep is very deeply, and unfortunately dream is occur, very horror dream. Automatically the heart rate, blood pressure and respiration, they are tend to the fluctuate. Okay, this happen in the rapid eye movement. And see the next, non-rapid eye movement. Non-rapid eye movement, NRE, non-rapid eye movement sleep. It is slow wave, slow wave of EEG. Okay. EEG sleep. During that phase, during non-rapid eye movement, during in that phase, heart rate, blood pressure, respiration is steady. It is not steady. It is not fluctuate because no dream occur. No dream occur in that phase. Okay, see the non-rapid eye movement, REM is sleep. It's a slow wave of EEG sleep. Heart rate, blood pressure, respiration is very steady. There is no any dream occur. They are constant. Sleep should be the no dream, and then remaining parts not fluctual. Sleep is occur. Okay. Now the sedative hypnotics are the both generally CNS depressant. Earlier I told you sedative hypnotics are the CNS depressant. Now the classification. First, barbiturate, first class. Then example of barbiturate, phenobarbiturate, second example, pentobarbital, second, benzodiazepines, example, diazepam, natrazepam, third, next class, alcohol, example, chloral hydrate, aldehyde, next class, aldehyde, example, paraaldehyde, next class, piperidinidione, example, glutamate, 6, bromide, 7, miscellaneous agent, example, promethazine, diphenhydramine, both are antihistamine. Another example, meprobamate. Now see the classification. Sedative hypnotics are the drug responsible for both are having the CNS depressant activity. The classification, there are total 7 class. First, barbiturate, example, phenobarbiturate, pentobarbital, second class, next class, benzodiazepines, example, diazepam, natrazepam, alcohol, chloral hydrate, next class, aldehyde, example, paraaldehyde, piperidinidione, example, glutamethidine, bromide, 7, miscellaneous agent, promethazine, diphenhydramine. They are the category is the antihistamine and meprobamate. It's a classifications. Now see the next. See the pharmacology of barbiturates. In the past, barbiturate is most popular sedative and hypnotics. In the past, it's very popular sedative hypnotics they are used, but nowadays they are less used. The they are the derivative obtained by barbituric acid. They are the derivative of barbituric acids. Now barbituric acids, the structure CNH, CO, CNH, CO, C double bond H and C double bond O. That number 1, number is 2, 3, 4, 5 and the 6 number is given. Now these are the structure of barbituric acid. This is the structure of barbituric acids, and the barbituric acid is prepared by replacing the carbon number 5. The hydrogen is replaced by aryl or alkyl group and replaced by oxygen. Carbon number 2 oxygen is replaced by thio group. That compound is called as thiobarbiturate. Thiobarbiturates, which are most potent, which are the most potent sedative hypnotics. And the sodium salt of these are water soluble. These are water soluble. See the barbiturates. Now see the pharmacology of barbiturates. Barbiturates in the past used most popular sedative hypnotics, but nowadays it is not used. The barbituric acid is replaced by carbon. This is the structure of barbituric acids. They are having the 6 carbon, number 1, 2, 3, 4, 5 and the 6. In the 5 carbon, hydrogen atom is replaced by alkyl and the alkyl or alkyl group or aryl group, or carbon number 2 oxygen is replaced by the thio group. That compound is called as the thiobarbiturates. Thiobarbiturates, which are the most potent sedative hypnotics. Along with the sodium salt, these are the water soluble. Sodium salt, along with that sodium thiobarbiturates, they are having the property the water solubles. Now see the pharmacology. Just introduction of barbiturates. Now see the pharmacological action of the barbiturates. Now see the first mechanism of action. Mechanism of action of barbiturate, it is not clear. Exact mechanism is not clear. Barbiturate act to the gamma aminobutyric acid, that is called the Gaba receptor. The Gaba receptor. They act with the Gaba receptor. They act, increase the barbiturates is act. They increase the inhibitory activity of the Gaba receptor in the CNS and barbiturate interact with the Gaba receptor. They form a, here is a Gaba receptor complex, barbiturate and the Gaba receptor complex. then they increase here inhibitory activity of Gaba receptor. Barbiturate is act, they form a complex and they increase the inhibitory activity of Gaba receptor, and the chloride ion conduction is increased, and they produce here the chloride ion conduction increase, and they produce the sedative and hypnotic effect. This action is mediated only the barbiturate. It is not used for the benzodiazepines. Again, I can explain. See, mechanism of action, it is not the clear. The GABA receptor barbiturate interact with the GABA receptor and they form a complex, and this complex, the barbiturate acts in the GABA. Their inhibitory activity of GABA receptor is increased, and then the mediate through the GABA chloride ion conduction should be the increase. Chloride, this is the chloride ion conduction should be the increase, and after that they produce the sedative and hypnotic effect. It is the mechanism of action, okay, of barbiturates. Now see the first action on CNS, effect on CNS. The action on the CNS, the all degree of depression on CNS, and the effect is dose dependent. The effect is dose dependent. Thus they produce sedation, sleep, anesthesia, and coma, and sometime some have anti-convulsant effect. Now, they have no analgesic effect. They have no analgesic effect. The smaller dose of this barbiturate of this produce sedation, and the large dose of barbiturate produce hypnotics. Now see the action on the CNS. Again, see this barbiturates exert the primary action on the CNS. First, barbiturate exert the primary action on CNS. They produce all degree of depression on the CNS, and the effect is totally dose dependent. Now here is the word is effect is produced totally dose dependent. See, the same drug act as a sedative and hypnotics. Now is totally dose dependent. The barbiturates is act sedative, and barbiturates acts as hypnotics. But sedative is act as they are used the smaller dose. Hypnotics used as a large dose. That's why it's called as the effect is produced totally dose dependence. Thus, they produce sedation, sleep, anesthesia, coma, and some have the convulsions when you are used. They have no analgesic effect. Okay. Now this action on CNS of the barbiturates is the most important. Smaller dose of these produce the sedation, and the larger dose of barbiturates produce the hypnotic. Same drug is sedative, hypnotics totally is a dose dependent. Okay, it's a dose dependent. Next, effect on next should be the respiration. Effect on respiration. They depress the respiration, especially in the large dose. The large dose produce depression of respiration. Then the excess death should be occur due to toxification due to the respiratory failure. Okay. Barbiturate does not have antidepressive action. Okay. The barbiturates is a large dose is cause CNS depression effect. Death is occur due to the toxification, respiratory failure. For the respiratory failure, they don't have any antidepressive actions. Next, effect on CVS. Therapeutic dose, much not effect on CVS. There is not effect in the CVS. They cause the mild hypotension, but toxic dose produce fall in the blood pressure. Okay. Due to myocardial activity, and ganglion blockers. Next, effect on smooth muscle. Previously you can see the CVS. Therapeutic dose of barbiturate does not much more effect on this cardiovascular system, but it causes mild hypotension. The toxic dose, lethal dose, is cause fall down in the blood pressure due to the myocardial activity of the heart and ganglion blockers. Okay. Now next should be the smooth muscle, effect on smooth muscle. The smooth muscle tone and motility of GIT, gastrointestinal tract, is not affected with normal dose. But gastric secretion is decrease. No significant effect on bronchial and uterine muscle. Next, effect on kidney. The barbiturates tend to reduce urine flow by decreasing blood pressure and increasing ADH release, means anti-diuretic hormone is released. See again, the kidney, effect on the kidney. Barbiturates tend to reduce the urine flow by decreasing the blood pressures and increasing the anti-diuretic hormones. Now see, barbiturates. Now see the therapeutic uses. Of barbiturates. It is act as sedative hypnotics. It is act as sedative and hypnotics. Okay. The small dose is act as sedative and the large dose is act as hypnotic, small dose act as sedative. Next, it is used in the treatment of anticonvulsant. Example, phenobarbital and methyl phenobarbital, used in the treatment of cranial epilepsy. Okay. Next, it is used as a general anesthetic. General anesthetic. Generally used general anesthetic. Example, thiopental sodium. And exobarbital. are used as intravenous anesthesia. Intravenous anesthesia. It is used for the neonatal jaundice. It is used for neonatal jaundice. Neonatal jaundice is a baby should be the 4 week. Is a 4 week baby age should be the 4 week. After the birth, baby is having the 4 week. They cause a jaundice, that is called the neonatal jaundice. Okay. Now, their adverse effect. Adverse effect. The barbiturates overdose cause the hangover effect. Hangover effect. You know the way. Very much hangover effect. Very common now. Okay. It's a very common effect. It causes hypersensitive action. Cause skin rashes. When high dose causes the reaction of swelling of the eyelids and the lips. Okay, eyelids and the lips should be the swelling. Another is tolerance is developed. Tolerance is developed. Tolerance developed and also dependence. Tolerance and the dependence is developed. Both is developed because on the repeated administration, you know the tolerance. The repeated administration of the dose because of physical tolerance is developed. Okay. Now their preparation and the doses. First, long acting barbiturates. Long acting barbiturate. Duration 8 to 16 hours. Example of such a drug: phenobarbital, barbitol 300 to 600 mg. Phenobarbital is dose 3 to 120 mg. Second, intermediate acting. Intermediate acting barbiturates. Duration is 6 to 8 hours. Example: butarbitol, dose 100 to 200 mg. Amylobarbitol, another example: amylobarbitol, dose same 100 to 200 mg. Third, short acting barbiturates. Duration of action is 2 to 6 hours. Example: pentobarbital, dose 100 to 200 mg. Secobarbital, dose same 100 to 200 mg. And the last, the fourth one, ultra short acting ultra short acting, duration is 1 hour. Example, thio into sodium and exo barbiturate. Okay, thiopental sodium dose is 100 mg and the exobarbiturate dose is 250 to 500 mg. Thank you.